my name is Jody Modell. I am the Director of Interim Healthcare, the Gift of Hospice, and I'm going to be demonstrating bag technique. For the purposes of this video, I will be using the table as my floor so that you can better see what I'm doing. I'm going to go ahead and take my barrier and lay it down, and then I'm also going to use some newspaper as my barrier to also have a clean area right next to it. I will set up my trash bag that I'll be using later for all of the trash, and that's there. And I will go ahead and set my bag on top of my barrier to make sure that all of the strap and everything is on my barrier. And I'll go ahead and wash my hands. I will wash my hands with hand sanitizer of 62% more of alcohol or more, or I can use the sink and use warm soapy water and a paper towel. After I'm finished washing my hands, I'm going to go ahead and open my bag, which everything in here is already clean, and I'm going to set up. I have my sanitizer wipes that I'll be using at the end to clean off all of my equipment. I have a box of gloves, and if you're not comfortable having a box of gloves in your bag, you're more than welcome to pack a small bag of gloves in your own bag and set them out, and take as many as you need out. And if you don't use them all, you can put them back into the small baggie and back into your supply bag. I'm also going to go ahead and take out my blood pressure cuff and my stethoscope. And in the event, just in case I may need some dressing or wound care done for my patient, I'm going to take out my dressing supply kit that I have here personally and set that out as well. That has some scissors and some dressing supplies in here for just the basics. When I'm finished taking everything out of my bag, I'm going to go ahead and zip it up. I don't want pets or children to get into my bag just for their safety. Once I am finished providing care to my patient, I'm going to go ahead and clean all of my supplies and put them back into my bag. And as I'm going along, I will be throwing out the trash in my trash bag and setting all of my clean supplies back in to my bag. Since I didn't use all of my gloves, I'm going to go ahead and put those as well into my bag here. And close up my dressing supplies as well. If I did do wound care, I would be using a red biohazard bag and leaving that bag at the patient's home for their disposal. But since I did not use any wound care dressing supplies today, I don't need to worry about that. Again, if you're going to do dressing changes, you must have a red biohazard bag and be disposing that in the patient's own trash. Once I have all of my equipment back into my bag, I'll go ahead and zip it and open the dirty side of my bag, which is this zipper here. I will take my barrier and my clean area that I used, fold it up, and if I did have any soiled diapers, they would also be in here. I'll be taking all of my dirty bag here of trash and placing it into the dirty side of my bag, zipping it up, washing my hands, leaving the patient's home, and disposing of that dirty trash once I get to my car into the appropriate dirty box I have assigned for it. Thank you.